Hello, my name is Jayla McMurray, and I'll be negating the proposition that sex education should stay the responsibility of the parents. Sex education is the instruction of issues relating to human sexuality, including emotional relations, responsibilities, human sexual anatomy, sexual activity, sexual reproduction, age of consent, health, rights, safety, birth control, and abstinence. Many people think that sexual education should be left up to the individual's parents or even taught at the earlier stages of adolescence. Your opinion may vary based on culture, religion, or even social economic status. There have been many studies conducted that question how beneficial the absence of sexual education is for children. This has been a long debated topic. Currently, only 29 states and the District of Columbia require public schools to teach sex education, according to the National Conference of State Legislators. Sexual education is not only a tool to be more informed, but it's also a way to learn how to make healthier choices that will produce healthier outcomes. For my first point, teens engage in sexual activity. The birth rate for women ages 15 through 19 was about 18.8 per every 1,000 women in 2017, which was a drop of 7% from 2016. According to the CDC, reasons for the decline are not entirely clear, but evidence points to teens abstaining from sexual activity and the increased use of birth control in teens who are sexually active. It is also speculated that this is due to the rise of sex being talked about in mainstream television and by mainstream personalities and celebrities. Sexually transmitted infections, or STIs, disproportionately affect adolescents due to a variety of behavioral, biological, and cultural reasons. Young people ages 15 to 24 represent about 25% of sexually active population, but acquire half of all new STIs, or about 10 million new cases per year. Data analysis showed that the more abstinence was stressed, the higher rates were of teen pregnancy and teen births. Of the four approaches, the most effective level, which included comprehensive sex education or HIV education, and covered contraception, condom use, and abstinence. And for my second point, not teaching sexual education may actually increase the likelihood of teens engaging in sexual activity. A child is exposed to information about sex from sources such as school, friends, and the media at a much earlier age than parents expect. If your child is taught sex education at school, ask them what they learned and review it with them, says Doris Leong, who is a sexual education teacher. Studies show the more children are exposed to sexual images in the media, the more likely they are to engage in sexual behaviors at a younger age. However, actual sex education does not lead to promiscuity. Children who receive sexual education at home and at school are actually less likely to engage in risky sexual activities. There are youth in our province who don't have the benefit of caring or informed families who are willing to provide sexual education at home. These youth would miss out on critical information about consent, healthy relationships, sexual health, and identity, and it puts them at a greater risk for abuse, sexual illness, and mental health crisis. There are a lot of children who don't have the opportunity to talk those things through with their parents or family for a variety of different reasons. So not having that information available to them at school is actually doing a lot of people a disservice. So just because it can be talked to home doesn't mean it will necessarily be talked about at home, or even talked about in an accurate way. A study that was conducted on 1,000 Americans showed that only 12% of respondents ages 60 years or older had some form of sexual education in school. Meanwhile, only 33% of people between the ages of 18 through 29 years old reported having any at all. So there are a lot of people who aren't the most knowledgeable on that topic, who are trying to inform and teach others. And a lot of times, because there's stigma surrounding it, don't have really any form of conversation or knowledge being shared about it, besides to not do it. And finally, for the people who are not knowledgeable or taught about sex, are more likely to engage in forms that exclude vaginal sex. So they are more likely to engage in oral or anal sex, which of course can result in contracting a number of diseases. In conclusion, sex education should not stay the responsibility of the parents. Sexual education is a great way to ensure youth have the accurate information that they need to stay healthy and to ensure the health of others. Teaching sexual education at home is a great tool, not exclusively, but in addition to formal age-appropriate education. Sexual education isn't about promoting promiscuity, but it's about creating a culture that values safety. And that concludes my debate on the proposition of policy. Thank you.